Have you been diagnosed with a blighted ovum? It's a type of miscarriage and a lot of questions. What causes it? How did it happen? What can you do to prevent it from happening again? Stick around because today you're going to learn all you need to know about a blighted ovum. I'm Dr. Laura Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist helping people build families and unfortunately deal with miscarriages for almost 20 years. And I love educating. I am so glad that you found this video and found this channel. Be sure and subscribe so you get my weekly videos all about reproductive health. Two other ways to stay in touch and to learn more. Number one, my newsletter. You can sign up in the link in the description below. You get weekly updates on fertility in the news, content that I produce that week, education, and products and things that I recommend. You can also listen to my Baby or Bust fertility podcast wherever you listen to podcasts, interviews with people in the field, fertility warriors, incredible conversations, and lots of learning. Today, we're going to learn all about blighted ovum. A blighted ovum is an early miscarriage. It's a description of a type of miscarriage, and I want you to learn all about it. Today, we're going to go over 5 main topics. Topic number 1, we're going to learn exactly what a blighted ovum is. Topic number 2, we're going to go over diagnosis. Topic number 3, causes of a blighted ovum. Topic number 4, treatment options. And finally, topic number 5, chances of it happening again. Now, stick around to the end where I want to go over questions I want you to ask your doctor and about your personal situation and diagnosis. Topic number 1, what is a blighted ovum? Blighted ovum is a type of miscarriage. It's describing an early miscarriage. And oftentimes we don't use that in medicine anymore. We don't see it in academic papers anymore. What it's typically described as today and recently is an empty gestational sac. It's describing a pregnancy that stopped developing pretty early along in the process. The pregnancy develops in very predictable stages at different times through that first trimester. And you can often tell by just looking at the transvaginal ultrasound where somebody is in their pregnancy. We've learned so much about dating pregnancies and how pregnancies developed with the use of a transvaginal ultrasound. Let me explain. When you get a positive pregnancy test, which is when you miss your period, you're actually about 4 weeks pregnant. Now, of course, this is assuming that you're having pretty predictable monthly menstrual cycles and monthly ovulation. But a dating of a pregnancy is typically based on the first day of your last menstrual period. So if cycle day 1 is the first day of bleeding, you ovulate around cycle day 14, and then around cycle day 28, if you don't get another period and you're expecting it and you have a positive pregnancy test, you're about 4 weeks pregnant. 2 weeks leading up to ovulation, 2 weeks after ovulation, that's 4 weeks, positive pregnancy test, 4 weeks pregnant. Now, of course, there's variation with that. And for people who have irregular and unpredictable cycles, it's going to be a little bit different, but that's where the basics come from. When you're 4 weeks pregnant, the pregnancy is so small that you cannot see anything on ultrasound. But about a week later, like around 5 weeks up to 5.5 weeks, you can start to see something within the uterus. You can see an empty gestational sac. So I'll show a picture here. You can see uterus. We're looking at it from the side, and you can see this black circle in the middle of the uterine cavity. That black circle is an empty gestational sac. It's fluid. Fluid on an ultrasound looks dark, and that is pretty typical for a very early pregnancy. It's typically the first thing that you can see in a developing pregnancy. Now, a couple of days later, at 5.5 weeks of pregnancy, you'll start to see a little circle within that gestational sac. That little circle, and I'll show a picture here, is called a yolk sac. And this is actually what is, helping develop an early pregnancy before the placenta really gets started and helping to support that pregnancy. So it's a little tiny circle within the gestational sac. That's a yolk sac within a gestational sac. And you can guess, oh, that person's about 5.5 weeks pregnant. Now, a couple of days later, isn't it amazing how fast this happens? At about 6 weeks of pregnancy, you'll start to see a little grain of rice right next to the yolk sac. And again, I'll show a picture here because this is the fetal pole. And truly, that little structure is about the size of a grain of rice. That is the baby developing next to the yolk sac within the gestational sac. And so when you see that, you say, oh, you're at about 6 weeks pregnant. And then a couple of days later, you see a heartbeat, little flicker of a heartbeat within that fetal pole next to the yolk sac, within the gestational sac, that happens about 6.5 weeks of pregnancy. So sometimes people are diagnosed with a blighted ovum or an empty gestational sac, especially if you know when someone got pregnant, they did an embryo transfer, they did an IUI, they have regular predictable cycles, and they're sure of when the first day of the last menstrual period was. And they really should be about 6.5 weeks along, or 7.5 weeks, or sometimes even 8 weeks gestation is your first ultrasound. And if all that's seen is an empty gestational sac, it seems like probably the pregnancy is not developing as it should. And that can be diagnosed a blighted ovum. So you should be further along. We know these stages of development, and all you see is an empty gestational sac. And so sometimes people will say, I'm so sorry, but this is a blighted ovum or a miscarriage or an empty gestational sac. It's really just a pregnancy that stopped developing really early along in the process. Topic number 2, how do you diagnose a blighted ovum? Well, I've already started talking a little bit about how what we expect to see on ultrasound at certain gestational ages, if it's not that far along, it's not that developed, then you sort of think to yourself, gosh, this might be a miscarriage. The pregnancy, egg and sperm fertilized, embryo started developing, it implanted, a gestational sac was created, but it just did not continue to develop. And so you can sometimes tell just by timing, especially if you know when someone got pregnant. Again, they did fertility treatment or they have really regular cycles and they understand the timing. Sometimes people will have symptoms like spotting or cramping, and they sort of know, gosh, maybe this pregnancy is an early miscarriage. And then you come in and you sort of see it's not developed where we would expect it to be. Sometimes people have no symptoms whatsoever. Sometimes people get diagnosed with something called a missed miscarriage, meaning that the pregnancy stopped developing, but the pregnant person never got the signal that something was wrong, like spotting or cramping. Oftentimes, especially if it's a real surprise, if it seems like, there's no symptoms of a miscarriage, people sometimes still feel pregnant, sometimes it's such a shock, we often offer just a follow-up ultrasound, just to sort of say, maybe it's just a little bit slow developing, maybe we just give it a little bit more time and we might see a yolk sac the next time you come in. And that is often offered, especially if someone is not sure exactly when they got pregnant. So sometimes people will get an ultrasound, they can't remember when the first day of the last period was, especially if it's a spontaneous pregnancy, meaning no fertility treatment or like kind of timing that they can look back on. And the doctor will say, listen, based on when you think your period is, I would expect you to be further, but let's just give it more time. Maybe you actually ovulated later than you thought. So with time, with a follow-up ultrasound, with understanding when someone got pregnant or based on fertility treatment. Sometimes follow-up blood tests, a beta HCG could be checked on the day that you get this ultrasound that shows maybe an empty gestational sac, and maybe you get a blood test at that time and the beta HCG is a certain value. Maybe you could check 2 days later. And if it's dropping, beta HCG when you're pregnant and the cells are developing, that should always be rising. That's the sign of a healthy early pregnancy. But if the pregnancy hormone level, the beta HCG drops, that can be a diagnosis of a pregnancy that's not going to continue. So it can be so frustrating to be pregnant, a highly desired pregnancy, and you go in to get an ultrasound, you want that reassurance that everything's okay, and be told, gosh, we're not sure. We need to follow up with more blood tests or another ultrasound to really help you figure out what's going on. And I know that is such a difficult situation to be in, but when you are really wanting to build your family and it seems like the right thing to do, sometimes just waiting to be 100% sure is the right thing. Talk to your doctor about your personal situation. Topic number 3, what causes a blighted ovum? Oh my gosh, so many thoughts. It's a miscarriage. It's a pregnancy that stopped developing. And so all the causes of miscarriage that we've talked about in multiple different videos here or in my book, Not Broken, An Approachable Guide to Miscarriage and Recurrent Pregnancy Loss, I have an entire chapter just on causes of miscarriage. Most of the time, a miscarriage is caused by something within the embryo, a chromosome abnormality, a genetic issue. Sometimes we can't always diagnose it. but it's something with that particular embryo that just didn't have all that it needed to continue, not something with the person who's pregnant or the people that are getting pregnant together. But sometimes people, especially if they've had more than one miscarriage, will be offered recurrent pregnancy loss testing. And I have a whole nother chapter in my book on this and lots of information on YouTube and Instagram and everywhere. I try to educate on, you think about genetic issues with the people that are getting pregnant, hormonal issues, immune issues, blood clotting issues, anatomy issues. Like, you want to kind of think through all the different things that could impact the development of an early pregnancy to make sure that you're not missing something. But the vast majority of the time when we're testing the people that are getting pregnant, we don't find anything wrong because really it's just that particular embryo. And I know that that is frustrating too, but it's just really important before you start doing a huge list of tests with your doctor. That might really be the right thing to do, but just get a realistic expectation of whether they think they're going to find something or not, and make sure you have a follow-up visit with your doctor to talk about the result and make sure you get all of your questions answered. Topic number 4, treatment options for a blighted ovum or an empty gestational sac. This is a miscarriage, and the options are, depending on many different things in your personal situation. If you are already having symptoms of bleeding and cramping, you are probably starting to actually pass the pregnancy and have a miscarriage. And so oftentimes people will do expectant management and get lots of counseling about what's expected and when you should call if you're having too much bleeding or too much pain. Then you can either take medication to sort of help that process along or be offered a DNC or a procedure to remove the pregnancy from the uterus. There are many pros and cons of those 3 different options, and I actually have a YouTube video here that talks you through those options, pros and cons of each. It's called Evaluation or Treatment of a Missed Miscarriage, and there are a lot of details in that video, a lot of questions to ask your doctor, and I hope that that would be a really valuable, helpful resource for you if you are in this situation and trying to decide which path is right for you. Topic number 5, chances it will happen again. It's the chances of having a miscarriage. So every time someone gets pregnant, there's a 25% chance of having a miscarriage. 1 in 4 pregnancies, positive pregnancy tests, 1 in 4 times after that, people will have a pregnancy that doesn't continue. It's a miscarriage. That is a very general number, 1 in 4. It's 1 in 4 pregnancies, not 1 in 4 people. So it's actually probably more common than we think. If we think about it just being 1 in 4 people, it's 1 in 4 pregnancies. And there's things that can predict it happening more often than that or less often than that. But that general number, 1 in 4 pregnancies, is typically given to people. Things that increase the chances of having another miscarriage are egg age. So once we get over the age of 35, over the age of 38, over the age of 40, chances of miscarriage increase exponentially because fewer and fewer eggs are able to go through all the genetic changes that they need to in order to fertilize and have all the parts that they need to continue into healthy live birth. If you've had a live birth in the past, you have a lower chance of having miscarriage in the future. Paternal age, sperm age does have an impact on risk of miscarriage. It's just not as dramatic, and it doesn't usually show up until into 50s or even later for men. Of course, if you have a chronic medical condition or untreated hypothyroidism, untreated diabetes, certain medical conditions can put you at a higher risk of miscarriage. So these are important things to talk to your doctor about and get that right answer for your personal situation. I'm glad you stuck around to the end of the video. I want to give you 4 questions to ask your doctor if you get this diagnosis. Question number 1, what are your options for resolution of this pregnancy? Expectant management, medical management, or surgical management? And go through the pros and cons for your personal situation. Question number 2, what caused this miscarriage? And are there any tests that doctor would recommend? Remember, most of the time it's something within the embryo, but it's okay to ask the question and see if there's anything in your medical history or any test that your doctor would recommend now. Question number 3, when can you try again? Most often people could try with the period after they resolve the current blighted ovum or that pregnancy, but that is very personal and you should talk to your doctor about when to try again for you. I do have a video here on YouTube that talks about when to try again after a miscarriage. And I hope that that would be helpful. Question number 4 for your doctor: what are the chances of this happening again? I think that's really important. It's a very different conversation with someone who is 30 years old. It's their second pregnancy. It's a blighted ovum. They conceived easily. They've gotten their questions answered and they're ready to try again, versus someone who is 40 years old. They did conceive spontaneously, but they had a miscarriage. They are starting their family. They want to have 2 kids, kind of understanding the higher risk of miscarriage at age 40 and thinking about your family goals. This is really important to talk to your doctor about what is right. I want to end this on a positive note because I know it can be really scary to get the diagnosis of a blighted ovum and worry about what this means for you and the family of your dreams. Things that I tell my patients are: a miscarriage is not your fault. You did nothing wrong. If you think about it, so many things are going right. It means that you ovulated. It means that the egg and sperm liked each other and fertilized, and the cells grew, and the uterus accepted that embryo. Implantation happened. So all of those huge steps in this process of family building were going right, and it most likely was just not a perfect embryo. And so a lot of times, if you get this information, if you ask your questions, oftentimes when you try again, you don't have the same thing happen. And I want to remind people that every pregnancy is a new opportunity. So it's a brand new embryo. It's a brand new try. And I just really hope that this education helps you, reassures you, and gives you the information that you can have a really informed and helpful conversation with your doctor. Be sure and like this video if you learned something, comment with questions that you have, subscribe to this channel so you get my weekly videos all about reproductive health. Be sure and look for the link for my newsletter below. You can find more resources on miscarriages and early pregnancy in my playlist here. And until next week, wishing you love, luck, and pineapples.